next we're going to hear, our next two speakers are co-presenting. That is Roman Garcia and Alexandra Brodard. They are presenting on the topic of improving access to healthcare for autistic patients by collaborating with autistic peer practitioners to provide free online training and develop practical tools. So I'd like to welcome you both on stage.
Okay, hello everyone, and welcome to our presentation. We hope you're doing well and that you're not too hungry yet. So thank you for your patience.
While discussing, yeah, this one is working, okay. While discussing how we were going to go about this presentation, we thought that you probably don't need to be reminded of the barriers we autistic people face to access healthcare services or to know the specifics of the genesis of our project. So we asked ourselves, what could you bring home about our project? And so what's our specific strength?
And we realized that our collaboration, thinking together, presenting together, that's the common thread we want to put forward and that you can take as a take-home message.
And I am autistic and a special educator and a peer practitioner.
And I am a psychologist, currently working as a research assistant for the ECTSA project. And every part of our work has been thought through as a partnership between healthcare professionals and autistic adults and or patients and carers. And we are going to illustrate our collaboration through four main topics today with you. So the main...
With our question in head, what does our partnership bring to the table in these actions? Oh yeah, thank you. And here you can appreciate a picture of our current team. ECTSA has always been carried out by bringing together the expertise of healthcare professionals, nursing school teachers, autistic peer practitioners, and family members. This collaboration resulted mainly in the creation of an online training course for healthcare professionals. Anyone can register for it. It doesn't require any specific knowledge, well, except you need to speak French because we're in French Switzerland. And it is entirely free, up to the attestation you can get by completing the final assessment.
So, can you hear it? Oops. Is it? It's on? Okay, I can't hear myself, that's why. Sorry. So it all started back in 2021. And since then, over 1,000 learners from various French-speaking countries, mainly Switzerland, France, and Canada, registered to our platform. We have healthcare professionals, of course, but also autistic people, family members, and just curious
and
learners.
Also like admin staff in medical,
centers.
Accountants,
yeah.
Or like that.
Right now, the platform is undergoing a major revamp in order to improve its content and user experience. Once again, we draw from our respective strengths and expertise to manage this revamp.
For example, I am often challenging the rest of the team on the correct terminology and concepts used to describe autism, but they keep reminding me that healthcare professionals often only rely on stereotypes about autism, and I'm more into specific wordings and all. So we have like long debates on how to keep our formation respectful on a neurodiverse point of view, while still highlighting the real challenges so the professionals can get a realistic understanding of the situation.
In addition to the free online course, we also give in-person trainings to healthcare professionals who seek to develop their practices. For now, we have interventions in general hospitals, dental clinics, home care providers, and ophthalmic centers, but the list will grow hopefully in the future.
Yeah. And for the last 2 to 3 years, I do the majority of these with our colleague Delphine, who couldn't be here today. But interestingly, even if I'm always there, people always contact her first and send her the invitation. And she always makes a point to include me or any other autistic peer practitioner we work with. Because this is how we collaborate, and it works wonders, as you can see. Funnily, for this event, it was the opposite, and it's only my name on the program, but I asked Alexandra to come speak with me. And in our team, like, everyone finds the work of the others so precious that we all want to put another one's name first. Like in the article we wrote, or we were supposed to do a poster presentation first. So who was the first name on the poster?
In addition to that, we also develop practical tools that you can download for free on our website. And Roman is going to present you one great example.
This is supposed to be a small pocket card that professionals can have in their front pocket in the medical blues. The front side, the first one, acts as a memo for healthcare professionals. As you can see at the bottom, it was a collaboration between many partners, such as the local outpatient care centers and 2 associations of autistic adults and parents. And that's the main thing the hospital asks us for. But we wanted to create a tool for connection and communication, and that's where the flip side comes in, and it gets more interesting. So it's supposed to be placed on the desk between the professional and the patient, and patient can point to the colors to express themselves or express any discomfort during the consultation. And healthcare professionals can reassess and adjust the action. And they have little reminders, like it can help if you tell how much time there is left, or if you check again the sensory environment or so. So the idea was to create connection and a communication tool where there are too many barriers.
Obviously, this is not a perfect tool, but we think it's a big step forward. Maybe you also have something similar in your countries, or maybe you can get inspired by our pocket card and create your very own when you get back home.
And the idea of most of our tools, like we have 3 for now, but yeah, is that it can be useful for both the patient and the professional.
Since most of us work at nursing school, the project is part of a bachelor thesis topic that students can select, and we have 12 students a year that join us for the participatory research. And
yeah, this year it was about the impact of peer practitioner in autism.
Mm-hmm. And here is a selection of quotes to illustrate what students think of this collaboration and what they take home as messages.
So the first one is about one of the sessions where we meet all the students for this year with peer practitioners and nursing school teachers. The students have to write reflexive notes after that. And one wrote, "We had the chance to meet 2 autistic peer practitioners. I thought it was great because no one is in a better place than them to talk to us about autism and answer our questions. The exchanges were very rich." And they all wrote things that we helped them understand or realize. And like this one, well, I have the timer and the quote, but I also realized that our definition of autism was only centered on deficits. It omits the fact that autism becomes a disability when it interacts with an no English anymore, with an environment that forces obstacles on the autistic person. And we chose this one as our last presentation slide because that's exactly what we aim at when we want to provide professionals with adequate and sensitive knowledge on autism. So one student wrote this year, I became aware that I have the responsibility as a future professional to get involved with respect, curiosity, and humility, but also to question practices and their meaning to ensure that they remain fair, appropriate, and consistent with people's needs.
All right, thank you for listening. We wish you a great day and a good time here at the conference.
I see a question just in the middle here. Yep, team are on it.
Thank you for your presentation. I had a quick question about the types of practitioners that you were interacting with. I am a sexuality educator myself, so I'm really curious if you were interacting with like gynecologists or any type of sexual health care staff.
Oh, that's our next in-person training. We are just like right now with like the comment on dit planning familial?
Community service for healthcare contacted us. Yeah.
For sexual education and care mostly for young people and LGBTQ communities. So that's the next project.
Yeah, we can't share our experience with that, but we're looking forward to it. Thank you for your question.
Thank you and well done. I am a representative from my colleague from Malta, and we have unfortunately, huge issues with this in our local hospital and mental health hospital. So I found it very interesting that you have an online training for the health professionals and also the tools that they can use. What's the possibility of having it in English? Because that would really help, because this can be used more internationally. We don't have people who speak French in Malta. Yeah. And if it's not a possibility, I'm interested myself. I'm an occupational therapist and also a parent of 3 adults with autism. And I'm really interested in how we can expand this in Malta.
Mm-hmm. Thank you for your question. So obviously the tools are in French because most of the team speaks French. But if you're comfortable with it, you can, of course, download everything and make adaptation in your own language. Or maybe you reach out to us and we can try to help you as much as possible to have material that's as close to the original version as possible.
Thanks so much. I think maybe some good conversations to happen there, sharing of contact details, etc. I think we might move on to the next speaker then, if that is okay. Thank you so much to both of you, and that was absolutely brilliant.